In a 2010 interview, Donatella said the following when asked about a natural look for women. "I don't even know what my natural color is. Natural? What is natural? What is that? I do not believe in totally natural for women. For me, natural has something to do with vegetables." But has plastic surgery played a role in Donatella's changing appearance? As always, estimated costs of potential procedures are included at the end of the video. In approximately 1980, at about the age of 25, when you look at Donatella's nose, you can see that there's a slight dorsal hump or a small convexity at the top of the bridge. When I look at her lips, I notice that her philtrum is relatively short. She also has a full upper lip that's slightly smaller than her bottom lip. And when you look at her upper lip, you can notice that the red portion of the lip extends all the way out to the oral commissure. Some people have a very different anatomy where the cutaneous portion of the lip essentially hangs down, and when you go out to the oral commissure from the cupid's bow, you start to lose the red portion of the lip. Donatella also has a very strong jawline, which is an observation that I often make in many of these celebrity analysis videos. In 1981, at the age of 26, what you can see here is that Donatella has proportional horizontal thirds of her face. So when you look at the hairline down to the top of her nose and then compare that to the top of the nose to just under the bottom of the nose, and from the base of the nose down to the base of the chin, those thirds are relatively equal. You can see that at the age of 26, Donatella already has some glabellar rhytids. She also has some visible under eye hollowing and slight nasal tip bulbosity. In 1984, at the age of 29, I see no change. And in 1988, at the age of 33, I also see no change. In 1989, at the age of 34, what I notice here is that Donatella has full brows. And that was in vogue more in the 80s, and it is more in vogue now. But as people entered into the 90s, they started to go for that more thin eyebrow look, and you'll see that coming up with Donatella as well. Fashion seemed to shift more to an emphasis on thin. Minimalism and grunge aesthetics became more of the norm in the 90s. In 1990, at the age of 35, I'm seeing that Donatella's glabellar rhytids are now more etched in. So when she's just at rest, you can see that those vertical lines are more prominent. She also has increased upper eyelid hooding. And I'm noticing reduced cupid bow definition compared to about 10 years prior. As we get older and we lose integrity in our tissues, the vermilion roll of the upper lip flattens. And while people make attempts to recreate that roll using filler, it's oftentimes not an exact match to the original roll. And when you inject at the vermilion border, as many of you know from prior videos, that filler can migrate into the cutaneous lip and it can increase that appearance of duck lips. So it's very difficult to recreate the vermilion roll once it's been lost, and also to adjust the contour of the cupid's bow can also be difficult. In 1991, at the age of 36, I see no change. And in 1992, at the age of 37, this goes back to what I said previously about eyebrows becoming thinner in this decade, and the same holds true for Donatella's appearance. Other than her eyebrows getting thinner, I'm also noticing that her lips appear fuller. Specifically, the upper lip has taken on a fuller look, and this could be due to silicone microdroplet injections. Silicone was first used in the lips back in the 1960s, but in the 80s and 90s, a fuller upper lip compared to the bottom lip became more in vogue, and that's when silicone started to make a resurgence. Because remember that HA filler was not widely available at that time, nor was it FDA approved for any indications on the face. One of the issues with silicone in the lips is that there's no antidote to reverse that material. Silicone starts to integrate into your tissues, and it can cause inflammation and become embedded in the tissues. So when we do surgery on tissue that's had silicone injected into it prior, when we're in there, we're not exactly seeing particles of silicone, but we're removing portions of tissue that likely contain silicone or some of the inflammatory swelling that it created and the scar tissue that may have formed around it. In 1993, at the age of 38, I see no change. In 1994, at the age of 39, I wanted to point out here that the rhytids or wrinkles are becoming more obvious in a static form, so when she's just at rest rather than animating the face. And you can see that in the glabellar area, you can see that in the crow's feet, and you can see it in the under eye region. Remember that Botox has heightened risk when injecting into the lower eyelid, specifically as it relaxes some of the muscles of the orbicularis oculi muscle. It can cause ectropion, which is essentially a lowering of the eyelid, and what that can lead to is dry eyes. So one needs to be very cautious when considering injecting the lower eyelid with Botox. In 1995, at the age of 40, I see no change. In 1996, at the age of 41, I'm observing here that Donatella's eyebrows are starting to look heavier and the brows have descended to some degree. As eyebrows drop down, what we start to notice is a crowding of the upper eyelid, and that supratarsal platform starts to become less visible. Even if you don't have extra skin of the upper eyelid, the brow sitting lower can start to create that type of upper eyelid crowding. And for some people, it can get so bad that they actually have difficulty seeing, and part of their visual field might be impacted by that extra tissue. So some brow lifts and blepharoplasties are not just for cosmetic purposes, but actually to be able to see better. Just like with rhinoplasty, some people get it just to look better, and other people are trying to breathe better. Same thing with brow lifts and blepharoplasties. Some people are just trying to see better, while some people are trying to balance the functional with the cosmetic, and yet other people are just seeking out cosmetic improvements. In 1997, at the age of 42, I'm seeing some signs here of a potential brow lift and blepharoplasty of the upper eyelid. I think it's important to bring up here that brow lifts are not just to lift the brows. They also can help with reducing the wrinkles or the static lines that we have on our forehead. And that could be the glabellar area, that can be those horizontal lines of our actual frontalis muscle. So before the days of Botox, this was a very popular choice, doing a brow lift to simultaneously elevate the brows, but also to smooth out the contour of the forehead. And if you look at Donatella's forehead and glabella, I think you'll appreciate that they're much smoother now than they were even the year prior. But one of the issues with performing a brow lift and a blepharoplasty is that you can start to create more hollowing in the upper eyelid area, and that can actually create a more aged appearance. So one needs to be careful not to remove too much skin of the upper eyelid. And when that combination of procedures is performed, brow lift and blepharoplasty, typically the brow lift is performed first, and then you see if there's any extra skin left after the brows are lifted. And oftentimes there's not that much more skin to remove. Sometimes there's some skin to remove, but usually the brow lift alone can correct a lot of the heaviness that people experience in the upper eyelid area. In 1998, at the age of 43, I see no change. And in 1999, at the age of 44, I also see no change. In the year 2000, at the age of 45, Donatella's upper lip is now looking fuller. And I think that there are three potential reasons why this might be. The first is that maybe she's had additional rounds of silicone again injected into the upper lip. Another possibility is that perhaps she started to get some HA filler placed into the lips. Remember that Restylane was the first FDA approved HA filler, and that was back in 2003, and specifically for the nasolabial folds. But of course, people were using it for other areas as well. And the third possibility is that perhaps this was still the previously placed silicone that was causing some persistent inflammation and lip enlargement. One of the main indications for a lip reduction is actually a history of silicone injections. Silicone tends to migrate and expand various regions of the lips over time, and there comes a point where some people feel that their lips have too much volume and they might seek a lip reduction for that reason. In 2001, at the age of 46, I'm noticing here that Donatella is starting to have more prominent platysmal bands. This is one of the more superficial muscles in the neck, and it extends onto the lower face as well. This is one of the main muscles that's manipulated during a facelift surgery. And Botox was recently FDA approved for injections into the platysmal bands, and that can be effective in softening this muscle to a degree. But remember that with Botox injections into the platysma, one must be careful with the dose that's applied because it's in the neck, and other structures in the neck control things like swallowing, speaking, and breathing. So if you inject too much Botox, you could have migration into these more critical structures that are controlled by their own muscles, and if you weaken them, then you could have some pretty bad consequences. In 2002, at the age of 47, I'm noticing that if you look at Donatella's lower jaw, you can see some jowling forming there. And jowling is caused by the cheek starting to descend with the aging process. And there are ligaments in the face that prevent structures from going into other zones. So in this case, for example, there's the mandibular ligament, and the cheek is not able to go any more medial than this ligament that's holding it back. And that's why you start to see that bunching forming in that location. Some people try to use some filler to fill more medial to the jowl to smooth out the contour of the jawline. Of course, another way to address this is with surgery with a lower face and neck lift. And of course, many people choose to leave this untouched. This is a very normal part of the aging process. In 2003, at the age of 48, what I wanted to point out here is that Donatella's lips appear to be changing. They appear less defined. And we're starting to see fullness of the upper cutaneous lip as well. And that becomes very difficult to correct. There are procedures like we talked about for the red portion of the lip, for example with lip reductions. But to try to reduce the volume, especially with a non-HA filler material of the cutaneous lip, is very difficult to do. And there really aren't any great surgeries to accomplish that task. So the best thing to do is to try to prevent it from ever happening in the first place. In 2004, at the age of 49, I see no change, and that's the same through 2007. In 2008, at the age of 53, I'm seeing some signs of cheek implants. These have now added some fullness to Donatella's lateral cheek. Previously, most of the fullness in her midface was at the medial cheek, and now you're seeing some extension of that fullness going more lateral. She also has reduced lower lid hollowing, and that could in part be due to a malar implant. Cheek implants are often designed to reduce that hollowing of the lower eyelid as well. And I think that given her fuller lips, the cheek implants provided some better facial balancing. Sometimes I find that cheek implants or filler injected into the cheeks can take away a lot of attention from the rest of the face. But if you have other structures that could balance against the new implants, then potentially the face can still retain some degree of harmony. And in 2009, at the age of 54, I wanted to point out in these images how well demarcated, in my opinion, this implant appears. You can really see its lower border quite well. Compare these images, for example, to Donatella in 1998, and you can see that stark contrast. In 2010, at the age of 55, I see no change. And in 2011, at the age of 56, I am seeing now some indication of a potential facelift. Even though the area around the ears is difficult to assess because Donatella frequently wears the hair sort of down over the ears, what we see is that the jawline appears tighter. There's less of the jowling that we saw previously. And this degree of contouring is difficult to achieve with non-surgical modalities. In 2012, at the age of 57, I see no change. And in 2013, at the age of 58, I also see no change. In 2014, at the age of 59, what I'm noticing is that Donatella wears a lot of eyeshadow, and with her lighter eyebrows and the lighter hair, you would think that most of the attention would then go to the eyes. But given the lip volume that she has, a lot of the attention when I just look at her face still travels, in my opinion, to the lower face first. And that is in large part due to the volume of the lips. They attract a lot of the attention. In 2015, at the age of 60, I see no change, and that's the same through 2017. In 2018, at the age of 63, it looks like Donatella may have had a rhinoplasty around this time. To my eye, the hump is no longer there. Also, the bridge and the tip of the nose appear to be narrowed. But her nose looks overall smaller, not bigger. Remember that if it was filler that was used to straighten out the bridge of the nose actually gets bigger because that's the only way to make it straighter. You add some filler above the hump and below the hump, and that's going to create a larger nose. But in Donatella's case, the nose appears smaller, and the only way to do that is typically with surgery. If you're looking for the Versace of skincare and hair care products at affordable prices, make sure to check out feelconfident.com. It's quiet luxury at its best. And it's my brand, and we really appreciate the support. So please show my team how much you love the products and go check them out for yourselves. One standout product is our HA Serum. Like all of our products, it's intelligently formulated. It has high molecular weight and low molecular weight hyaluronic acid molecules to balance hydration with the depth of penetration. So everything's been thought through with these products, and overall the feedback so far has been amazing. Thank you all for trying it, and if you haven't yet, make sure to go check it out for yourself. In 2019, at the age of 64, I see no change, and that's the same through 2022. In 2023, at the age of 68, I think that Donatella may have had a cheek implant revision, changing out her old cheek implants for slightly larger ones. I'm also seeing additional fullness and further demarcation of the lower jaw, and I think this may be because of some gonial angle implants as well. Those are intended for the angle of the mandible, and they go right over the lower jawbone. This has stretched out her face into a more square configuration. Her face appears less long and now a bit wider. It has also given her face more structure onto which the skin can be draped, so the tissues actually appear a bit tighter and less droopy. In 2024, at the age of 69, I think Donatella may have had a brow lift revision around this time. When you compare back to say 2020, you can really see that the eyebrows again appear more elevated. I know that when people saw some of the recent pictures of Donatella, they thought that a lot more had gone on in the last few years. And as I've tracked back, decades, I'm seeing that recently not too much has changed other than maybe this brow elevation that I'm seeing. But otherwise, I don't think too much more has changed. But lighting and angles as well as photo retouching can really change our perception of how someone's face appears. Case in point, when Donatella went to the Devil Wears Prada event on December 1st in 2024, she then released certain photos, and those photos look quite different depending on which photo you look at. This first photo, you can see her looking up, so the jawline is going to appear tighter and there's going to be less visibility of the neck with the way that the light is falling. It looks like the photo may have been retouched because the skin is just so smooth and glistening, and that of course adds to a lot of youthfulness as well. And then with the restructuring of her face over time, especially the bony anatomy with the potential implants, you see that kind of width to the face, so it overall looks quite youthful. Now in this other photo taken on that same day, you see quite a different picture. I mean, she still looks very youthful for 69, no doubt, but now you're really seeing the details of her skin, and you can see that of course there are some more wrinkles, and that's what you would expect to see on a person in their 60s. But you can really see that the texture is quite different compared to the last photo we looked at. You can see that the neck doesn't appear quite as smooth. Some of those platysmal bands are present. You can also see some of the irregularities in the lip itself from some of the treatments that we talked about in this video. So I think Donatella still looks beautiful regardless of which of the photos you look at, but you can see that each photo tells a slightly different story. And the total cost of these potential plastic surgery procedures is $190,000. What do you think about Donatella Versace's facial transformation? Are her looks all natural, or has she had a little bit of help from plastic surgery over the years? Let me know what you think and tell me who I should cover next in the comments below. Thanks for watching, and please subscribe to the channel.